So that 21-day national lockdown kicks in early on Friday. President Cyril Ramaphosa says the unprecedented move will help flatten the curve where the coronavirus infections are concerned domestically. What kind of behavioural changes do South Africans then need to adopt in order to minimise the impact of the pandemic? Well, for more on this, let's speak to Professor Salim Abdool-Karim from the Centre for the AIDS Programme of Research in South Africa. Prof, a very good evening to you. Thank you for being on Nightline. So we all know that we are to stay in our homes from Friday, wash our hands, sanitize and the whole bit, social distancing. What else do we need to be doing from a health perspective?
So when we look at the announcement of the lockdown, it's really a critical last resort step, and we're very fortunate in South Africa that we are taking the step at an early time compared to, for example, Italy or Spain or the UK, where they have taken the decision probably too late. But it'll only work if we follow the rules. And critical in that is to reduce the number of interactions between those who are potentially people who are infected with the virus with people who are not. So that is the critical interaction that we need to reduce. So that means the behaviors we expect is firstly to follow the rules, so keep social distancing, avoid crowds, stay in your house, minimize the interactions you have with any outside individuals. And if we can do that, and we can do that consistently for the next 14 days, we should, by the end of 21 days, see a drop in the number of cases and in the number of new infections. And if that happens, then we would know that we've taken the right course of action.
And I'm speaking to you, Professor Abdool-Karim, on World TB Day, of course, more significant today precisely because of this pandemic.
Yes, it's... For us, we've been dealing with tuberculosis for decades, and this is a country where we have a substantial tuberculosis problem. In a way, because we've had this problem, we have many of the systems in place. So we know how to test people, we know how to isolate them, we know how to manage infection control, we know how to do contact tracing. Many of the basic elements of dealing with any infectious disease that exists, we've already established for tuberculosis. And now we have a situation where those same systems are ones that we can use for this particular disease, COVID-19. And I think the extent to which we can utilize that experience is going to be critical. But at the same time, we have to ensure that we don't compromise our TB program by taking all the people who know how to do this away from TB. So it's got to be a balanced way in which we use our resources.
And as you say, South Africa quite well equipped when it comes to the treatment of tuberculosis and HIV AIDS, which is where you also work as a researcher. What is tricky, though, about tuberculosis and HIV AIDS patients is that at this stage there's very limited data to say how they fare when it comes to this new coronavirus. Why is that?
Well, you're absolutely right, because we just don't have data. And the main reason for that is that the first case of COVID-19, it wasn't even known at that stage, occurred in November, 17th of November last year. The first reports of this disease were in the middle of December last year. So if you take the middle of December last year to now, that's 3 months. That's all we've known about this virus. Remember, this is a new virus. We've never encountered it before. So the data we have mainly comes from China, and especially from the Chinese authorities who analyzed the first 46,000 cases. And in their analysis, they provided us with insights about who is affected and who is not. And what they showed us, very importantly, is that the elderly, those who are above 70, have a very high risk of severe disease, and even above 60. But once you get below 60, it has a very mild course. And that information has been critical to us understanding this. The issue is that there were no patients with tuberculosis or with HIV in the Chinese analysis. So we don't know how this disease impacts in patients who have these diseases. But we're going to know that soon, because as this virus spreads in South Africa, it is going to affect those patients, and we will get some understanding and some data about how to deal with this problem.
Would that then, Professor, be part of a bigger conversation about the mutation of this virus going forward? Because currently, as you're saying, we know we're dealing with the less aggressive and the quite aggressive strains, those two.
Yeah, it's not so much the strain, it's the host that influences whether you have an aggressive disease or whether you have a mild disease. And age is a key influencing factor in that case. So in children, in the analyses provided to us by the Chinese, most of the children had a very mild course. And in many of them, they didn't even know they had the disease because it was so mild. Whereas when you start getting to older people, it caused much more acute respiratory distress in older people. So they needed hospitalization. And with hospitalization, they often needed to be put on ventilators. They needed to get more oxygen because they weren't able to get enough oxygen through their normal breathing. And that means that we have to have ICU beds. And ICU beds are in very short supply. We have very few ICU beds in this country, in fact, in any country, to deal with an epidemic on this scale where so many people are going to need ventilation. And that's what we saw in Italy, that when you have this rapid growth in the epidemic and many patients need medical care, it just swamps the healthcare system. They just can't cope, and patients just keep dying because there isn't ventilators available. And we're trying to avoid that. And in the way in which we're avoiding it right now is what is widely called flattening the curve. We're trying to avoid this rapid increase through this lockdown so that the number of infections will still continue to occur, but they will be much slower. And that way our health system will be able to cope and patients will be able to get the medical care they need to survive.
And I want to then speak to, again, the issue of people who are on treatment for HIV AIDS, the antiretroviral treatment. It is especially important at this time that people do take their medication as per the directions of their doctors.
Yeah, we've seen certainly from other diseases like measles and influenza, particularly the studies done on influenza vaccine, show that patients who are HIV positive but who are on antiretroviral therapy, they respond very well to the influenza vaccine. And so just using that, because we don't have any data on this coronavirus, just trying to extrapolate from that, we anticipate that patients who are on antiretrovirals will have either a similar course of infection to HIV negative individuals or a slightly worse course of disease, but not much worse. The situation is different, however, in patients who have HIV but who are not on antiretroviral therapy, especially if they are immunocompromised and have low CD4 counts. We anticipate, and again, there's no data, I'm speculating here based on what we know from other viruses, that we would expect that those patients who are not on treatment, low CD4 counts, are likely to have a much more severe course of this disease.
Prof, thank you so much for being on Nightline this Tuesday. That was Professor Salim Abdool-Karim.